I'm Dr. Steve Murdoch, a chiropractor in the Kitchener-Waterloo area. I want to talk about carpal tunnel, which is really common and so many people have. It's obviously an inflammation in the wrist area through here, and what causes it a lot of times is repetitive strain. So if you're working in a factory or you're typing all day long, you aggravate it more and more and more. And what happens, these tendons come down into the hand from the forearm, and I'm finding that a lot of the problems stem from the forearm because the muscles are so tight. So I'm going to give you a couple little things that you can do that I explain to patients in the office and what you can do to take a lot of that tension off that area. Now these muscles here, the brachioradialis muscle is right here. Just get in there and squeeze. These are the extensor muscles of the hand. So these muscles here, when they shorten, they extend your hand. So just working in through there, like we call it trigger point therapy, and just squeezing there 15, 20 seconds or so relieves the pressure. On the other side here, these are the flexors. These will cause your hand to flex. So just working through there for about 15 seconds or so, just to relieve the pressure. Now, number two is just pull on the wrists. You have 8 little carpal bones in through here. Now, I'm more specific when I adjust the individual bones, but just general mobilization, a range of motion is really good to get some motion through there. And also the thenar muscle here, just push in gently. This is really tender. This is called the saddle joint, and it moves in all different directions. But when you push right there, it just helps to relieve a lot of the tension in the muscles, okay? The other good thing you can do as well is I suggest to put ice on the wrist, not heat. And the reason for that is when you have swelling in a joint, if you put heat on it, it tends to swell up even more. So even though it feels soothing when you put heat on it, I do recommend ice. And for a wrist like this, there's not a lot of fat tissue there. Probably 10 minutes is fine. And I wouldn't put the ice right on it because it might be too cold and you might burn your skin. The other thing you can do as well is just elevate your hand. If you had a little ice here, and elevate your hand, because when you do that, if you do that for about 10 or 15 seconds, I challenge you to do that at home, and bring your hand down. And with me, my hand's much whiter and there's no veins in here because it helps to drain the area. Okay? So that'll help with carpal tunnel, and ask me questions about it when you're in the office.